Hello and welcome to Ann Talks, recording for nurses by nurses. I'm Curry Bordelon, your host for today's recording. Today we're going to talk about how to develop and design an effective CV. But before we do that, we want to answer the question that's very common for many people. What's the difference in a resume and a CV? A resume tends to be a very succinct document that highlights certain education and skill sets for a particular job. Okay, it's usually only a page, maybe a page and a half. In a lot of cases, if you're doing an online application process, you might find that there's fields that you're putting content in that are part of building a resume in the background in a digital format. CVs are different. CVs are an opportunity to really highlight more beyond just the skills and education and how you have impact on, whether it be clinical care, how you in education, is there grants as part of research and publications that you might have or presentations and so forth. So a curriculum vitae, which is CV, is Latin for course of life. That's really where you're sharing beyond, like I said, sharing beyond just a certain skill set. You want to showcase and highlight what you can bring to that environment, how you can help change the way care is delivered, or how you can help have improvement within a clinical unit, how you can help institute certain policies, and how you can help develop and design protocols. There's two different types of formats of CVs in most cases. There's a chronological or functional. A chronological really focuses on the academic history and the professional experience, followed by other things such as grants and publications and licensure and so forth, professional associations. If you want to really highlight your consistency of employment, if you've been at the same employer for a very long period of time, you want to highlight that consistency, a chronological CV is very effective in that way because it talks about how your experience has been at a location where you've been there for a long period of time and what you've done in that location. Functional is a little bit different. Functional is more about your skills, your awards, your honors. And it's very effective when you've moved from different jobs or different role functions, or you recently graduated. That might be an effective tool for you to use. So functional is a little bit different. It's really, like I said, it's highlighting your skills, but you're fine-tuning that to that role that you're looking for. There are some situations where you might have a combination of the two. And it's really not one's better than the other. It's really just to kind of get you to understand that what you need to do is, as you're developing that CV, you want to focus to whatever job or function that you're applying for. That leads me to another point. You really need to make sure you're researching that company, that hospital, that entity, that facility, wherever you're trying to apply, whatever role you're applying for, whatever function you're applying for. You want to make sure you understand that company. What are their missions and visions? What type of work do they do? What type of patients do they see? What unit that you're trying to apply for, what is their focus? Is it oncology? Is it neonatal intensive care? Is it pediatric acute care? What is their focused patient? What types do they do research? Are they academic medical center? Are they not? Are they private practice? Are they an outpatient clinic? You're going to make sure you fine tune that CV to whatever that job role is. But you want to grab their attention within the first 30 seconds of the reading. Okay? You want to make sure that you want to grab their attention so that they read more about your skills and what you can bring to that unit. Show yourself as a problem solver. What impact do you have in that patient population? How have you helped change the quality of care that's delivered? Are you part of a protocol committee? Did you help initiate a protocol? Did you help initiate a survey? Or were you participating in research within that facility? All these things are very important to make sure that you drive home how important it is to highlight your skill set, because you're the one that is going up for this role or function. You want to sell yourself in the way that how you can bring impact and value to that environment. There are lots of online websites and there's lots of online resources to be able to help guide you in that process. There's also some professional information and professional development and so forth within the Academy of Neonatal Nursing, the website. So please feel free to look through that content to see if that could be helpful as well. So we hope this information has been helpful. We look forward to seeing you again. Thank you so much.